There is a request going to the Defense Department from the state of Michigan for what? Put it into perspective for me, please.
Sure. There is an opportunity for states who are especially challenged with things like a COVID surge to request Department of Defense assistance for medical personnel. And the MHA sent that request to the governor's office. The Michigan Department of Health and Human Services is also pursuing that request with the federal government.
Is there a request for a specific number of people? And I'm told this is nurses, respiratory therapists, and physicians. Can you confirm those are the personnel needed?
Yes, the types of medical officers that we believe are available are respiratory therapists, nurses, and physicians, probably more of the first two than the physician contingent. We understand that they generally come in teams of 15 to 22 people, and based on what other states have received in the past. And we, in our letter to the governor, which we sent late last week, we asked for a total of 150 in the state, but we are totally dependent on the federal government for what they decide to send to Michigan.
And just a couple more questions. Is this because of unprecedented staffing shortages, overloaded hospitals, or a combination of both?
I would say it's a combination of both. Not only do we have in some areas, a record number of people admitted to the hospital with COVID-19, we also have very high levels of people with high acuity diseases, whether it's types of heart disease or cancers or whatever else it might be. There are some really serious people who are very seriously ill who are in our hospitals. We have very high levels of census, even if it's not COVID. So the combination of high COVID census and high acuity of other types of illness.
And people are going to hear this, and I'm going to kind of ask this from a lay perspective, if you will. We're asking for federal help. This means extreme conditions exist. How would you respond to that statement?
There are and have been very serious circumstances in Michigan at different times over the past 20 months. And I would say that this is one of those times. And we have asked for assistance, for outside assistance in the past. For example, we had the situation in the first surge where hospital systems from across the country sent their workers to Michigan to help out. And in this case, all areas of the country have workforce shortage, and we don't have the same opportunity for organizations to send their own workforce to assist here.
Okay, last question I have. We've gotten guidance from the state, from Governor Whitmer and the Michigan Health and Human Services Department. No lockdowns like we had last year, no restrictions on gathering. Restaurants and bars were at 50% capacity for quite some time. So no lockdowns, no restrictions of any kind, just guidance. When would that need to change? How bad does it have to get before we move back into imposing restrictions, imposing lockdowns, imposing mandates? How far, a lot of people are going to say, this is getting out of control now, we need some of these measures. How do you respond to that?
So, it's not, I would feel very uncomfortable directing our state government about how they ought to issue orders and that type of thing. Recently, our chief medical officers just, a few days ago, issued a statement that said what I think is always good advice. If you haven't been vaccinated, you need to get vaccinated right away. The older you are, the more important it is that you get your booster shot sooner rather than later, yesterday if possible. And if you are in an indoor setting that has any more than a few people with you, and certainly if there's a risk that people who are unvaccinated are there, you probably would be wise to wear a mask. And that's what our chief medical officers are telling us. And that's the advice that I would share back out to folks. I think that there are many considerations, social and otherwise, about how to manage the public health considerations. And, I would leave that to the people who are more expert at public health. But I know what our medical officers are telling us, and that is the number one thing you can do here is get vaccinated and help those other around you make sure that they're vaccinated and also get their booster shot.
Very good. Anything I didn't ask you you'd like to add?
No, I think that's it.
Okay. Thank you so very much. Very much appreciated.
Sure.